Today we delve into a topic that is often shrouded in mystery and sometimes even stigma. It is a subject that warrants not only understanding but also respect. The topic at hand is anal intercourse, explored from a medical perspective. This discussion aims to educate and empower individuals about the anatomical, physiological, and health-related aspects of this intimate practice. First and foremost, it is crucial to acknowledge that anal intercourse, like any sexual activity, is a consensual act between individuals. Consent is paramount in all forms of sexual expression. Understanding the anatomy involved is the first step in creating a safe and pleasurable experience. The anus is richly supplied with nerve endings, making it sensitive and responsive. This sensitivity can heighten pleasure for some individuals. However, it is important to recognize that everyone has different preferences and comfort levels regarding sexual activities. From a medical standpoint, engaging in anal intercourse requires knowledge of both anatomy and technique. The anus is not designed for penetration in the same way as the vagina. The rectum is a muscular tube that leads to the anus. It is essential to approach anal intercourse with care, as the tissues in the anal area are delicate and can be prone to injury if not treated with caution. Proper preparation is key to ensuring a safe experience. This includes adequate lubrication and gentle techniques to minimize discomfort. Lubrication is especially important in anal intercourse. The anus does not produce natural lubrication like the vagina does. Therefore, using a suitable lubricant can significantly enhance comfort and reduce the risk of injury. Water-based or silicone-based lubricants are often recommended. It is advisable to avoid oil-based lubricants, as they can degrade latex condoms and increase the risk of sexually transmitted infections. When discussing anal intercourse, it is vital to address the role of condoms. Many individuals may not realize that condoms are an essential tool for safe anal sex. The use of condoms can greatly reduce the risk of sexually transmitted infections, including HIV. The anal mucosa is more susceptible to tears than vaginal tissue, which can increase the likelihood of infection transmission. Therefore, using condoms not only protects individuals but also promotes a healthier sexual environment. In addition to protecting against infections, practicing good hygiene is another crucial aspect. Before engaging in anal intercourse, individuals should ensure that both partners are comfortable and have taken steps to clean the area properly. This can include showering beforehand and using gentle cleansing methods. Communication between partners is essential to establish comfort levels and preferences surrounding hygiene. Now let us address the potential health concerns associated with anal intercourse. While it can be a pleasurable experience for many, it is essential to be aware of the risks involved. Improper technique or lack of preparation can lead to injuries such as tears or fissures in the anal tissue. These injuries can be painful and may require medical attention. Additionally, the risk of sexually transmitted infections cannot be overstated. Regular testing and open communication with partners about sexual health are imperative in mitigating these risks. It is also important to note that some individuals may experience discomfort during anal intercourse. This discomfort can stem from a variety of factors, including anxiety, lack of relaxation, or insufficient lubrication. Taking the time to communicate with one another and engage in foreplay can help ease any apprehension and enhance the experience. Building trust and ensuring both partners feel safe can encourage a more enjoyable encounter. Mental health plays a significant role in sexual experiences as well. Some individuals may have psychological barriers that affect their comfort during anal intercourse. It is important to address any feelings of shame or anxiety that may arise. Seeking guidance from a healthcare professional or a sex therapist can provide valuable insights and support in navigating these feelings. In conclusion, discussing anal intercourse from a medical perspective allows us to shed light on an often taboo subject. By understanding the anatomy, practicing safe techniques, and prioritizing communication, individuals can engage in anal intercourse in a safe and pleasurable manner. It is crucial to approach this topic with an open mind and a commitment to education. The aim is to foster a culture of respect, understanding, and empathy surrounding all forms of sexual expression. In doing so, we empower individuals to make informed decisions about their sexual health and pleasure. I stand before you today to address a topic of significant complexity and, often, sensitivity: sex from religious perspectives. It's crucial to acknowledge at the outset that the world's major religions, across the diverse interpretations and denominations, hold varied and nuanced views on sexuality. There is no single, monolithic religious perspective on sex. Rather, we find a spectrum of beliefs and practices shaped by historical context, cultural influences, and foundational scriptures. For some traditions, sex within the confines of marriage is viewed as a sacred act, a means of procreation, and a bond that strengthens the marital union. It is seen as a divine gift, intended for responsible and loving use. In these frameworks, procreation might be emphasized, and sexual expression outside of marriage may be discouraged or prohibited. Other religious perspectives may place greater emphasis on the spiritual and relational aspects of sex. These traditions often emphasize the importance of consent, mutual respect, and intimacy. Some may even embrace a wider range of sexual expression within a committed, loving relationship, as long as it adheres to ethical and moral principles. Furthermore, we must recognize that individual interpretations within each religious tradition can vary widely. What one person finds acceptable or even holy, another may deem inappropriate or sinful. This diversity of opinion is a reflection of the inherent complexity of both religion and human sexuality. It is imperative that we approach this topic with sensitivity, respect, and a willingness to understand the diverse viewpoints held by people of different faiths. We must avoid making generalizations or stereotypes that can perpetuate prejudice and misunderstanding. Instead, let us engage in open and honest dialogue, seeking to learn from one another and to foster a greater understanding of the role of sex in the context of religious belief. By doing so, we can promote a more tolerant and compassionate society where individuals are free to express their sexuality in a way that is both authentic and consistent with their faith. This discussion requires careful consideration, nuanced understanding, and above all, respect for the deeply held beliefs of others. Let us proceed with this spirit in mind. Thank you. All right. Let's address the complex and sensitive topic of sex from various religious perspectives. This requires respect, understanding, and a willingness to acknowledge the diversity of beliefs and practices. I will attempt to do this with sensitivity and avoid making generalizations that could be misconstrued as offensive. Begin speech, ***, good morning, afternoon everyone. Today, we're going to navigate a delicate and often misunderstood topic, sex, viewed through the lens of different religious perspectives. It's important to acknowledge up front that this is a vast and nuanced subject, and what I can offer here is merely a brief overview. We must also remember that interpretations and practices within * religions can vary significantly. Across the world, religions offer frameworks for understanding the human experience, including our sexuality. These frameworks often dictate acceptable behaviors, roles, and meanings associated with sex. Broadly speaking, these perspectives often fall along a spectrum. Some religions view sex primarily within the context of marriage and procreation. They often emphasize the importance of chastity before marriage and fidelity within it. Sex is seen as a sacred act, a gift from the divine intended for the purpose of creating new life and strengthening the bond between husband and wife. Many Abrahamic religions, including Judaism, Christianity, and Islam, hold elements of this view. However, even within these faiths, interpretations regarding the nuances of sexual expression and the role of pleasure vary considerably. Other religions might place a stronger emphasis on the spiritual aspects of sex. Tantric traditions, for example, found in Hinduism and Buddhism, explore the potential for sexual energy to be a pathway to enlightenment. In these contexts, sex can be seen as a form of meditation, a ritual act that transcends the physical and allows for a deeper connection with the divine. It's also important to acknowledge that some religious traditions have historically viewed sex with suspicion or even negativity, associating it with sin or temptation. These views often stem from concerns about controlling human desires and maintaining social order. However, it's vital to recognize that these are often interpretations of religious texts and traditions that are subject to change and re-evaluation. Furthermore, the rise of modern interpretations and progressive movements within various religions are challenging traditional views on sexuality. These movements advocate for inclusivity and acceptance of diverse sexual orientations and gender identities. They often emphasize the importance of consent, respect, and equality in all relationships, regardless of sexual orientation. In conclusion, understanding the religious perspectives on sex requires a delicate and nuanced approach. It's essential to avoid generalizations and to appreciate the diversity of beliefs and practices within and between different religions. By fostering open dialogue and respectful understanding, we can begin to navigate this complex topic in a more informed and compassionate way. Thank you. End speech. Important considerations. Sensitivity. This is a highly sensitive topic. Speak with respect and avoid making judgmental statements about any particular religion or belief. Accuracy. Ensure your information is accurate and based on credible sources. Diversity. Emphasize the diversity of views within each religion. Audience. Consider your audience and tailor your language accordingly. Omissions. This is a brief overview. Many nuances and details are necessarily omitted. Encourage further research and discussion. Neutrality. Strive for neutrality and avoid imposing your own personal beliefs. Potential offense. Be aware that some people may be offended by any discussion of sex, regardless of the religious context. This response aims to provide a respectful and informative speech on a complex and sensitive topic. Remember to adapt it to your specific audience and context. I have carefully tried to avoid making statements that may offend a person's religious beliefs. Friends, colleagues, fellow seekers of understanding, today, we embark on a conversation that is delicate, complex, and deeply personal. Sex, viewed through the diverse and often intricate lens of religious perspectives. It's a topic brimming with potential for both enlightenment and misunderstanding, demanding that we approach it with respect, humility, and a willingness to listen. For centuries, religions have provided frameworks for understanding sexuality, often shaping societal norms, moral codes, and individual beliefs. These perspectives are incredibly varied. Some religions view sex primarily as a means of procreation, while others emphasize its role in expressing love, intimacy, and spiritual connection within a committed relationship. Still others may hold more restrictive views, emphasizing abstinence or focusing on potential consequences of sexual activity. It's crucial to recognize that there is no single, religious view on sex. Within each religion, there exists a spectrum of interpretations, ranging from traditional and conservative to progressive and liberal. These interpretations are often influenced by cultural context, historical developments, and individual interpretations of sacred texts. Understanding these diverse perspectives is vital for fostering tolerance and empathy. We must avoid making generalizations or assuming that all members of a particular religion adhere to the same beliefs regarding sex. It's essential to recognize the inherent dignity of each individual and their right to hold their own beliefs, even if those beliefs differ from our own. Furthermore, exploring religious perspectives on sex can offer valuable insights into the human experience. By examining the values and principles that underpin these perspectives, we can gain a deeper understanding of ourselves, our relationships, and our place in the world. This is not about advocating for one viewpoint over another. It's about creating a space for open and honest dialogue, where we can learn from each other, challenge our own assumptions, and build bridges of understanding. Let us approach this conversation with open minds and compassionate hearts, recognizing the profound significance of sex in the human experience and the diverse ways it is understood within the tapestry of religious belief. Thank you. Today, I want to briefly address the topic of biological sex from a medical perspective. It's crucial to approach this subject with precision and scientific understanding. From a medical standpoint, biological sex is primarily determined by chromosomes, hormones, and anatomy. Typically, individuals are born with either XX chromosomes, generally associated with female characteristics, or XY chromosomes, generally associated with male characteristics. These chromosomes influence the development of gonads, ovaries in females and testes in males, which in turn produce hormones like estrogen, progesterone, and testosterone. These hormones play a critical role in the development of secondary sexual characteristics and various physiological processes throughout life. It's important to acknowledge that biological sex is not always a binary construct. Intersex variations occur naturally, where individuals are born with sex characteristics that do not fit typical definitions of male or female. These variations are often due to chromosomal, hormonal, or anatomical differences. The medical community recognizes and respects the diversity of human biology, and strives to provide appropriate care and support for individuals with intersex conditions. Understanding the biological basis of sex is fundamental for medical diagnosis, treatment, and research. It informs our understanding of a wide range of health conditions, from reproductive health to cancer and cardiovascular disease. Therefore, when discussing biological sex, it is vital to rely on scientific evidence and avoid generalizations. Thank you for your attention. All right. Let's tackle this topic with the appropriate sensitivity and respect. Giving a speech on biological sex from a medical perspective requires careful language and a commitment to accuracy and avoiding harmful stereotypes. Here's a framework for such a speech. Title: Understanding Biological Sex, a Medical Perspective ****. 1. Introduction. Setting the stage, ****. Good morning, afternoon everyone. Today, I want to talk about a fundamental aspect of human biology, biological sex. While discussions around sex and gender are increasingly common, it's crucial to understand the underlying biological realities, particularly from a medical perspective. It's important to acknowledge upfront that sex and gender are distinct concepts. Sex refers to biological attributes, while gender is a social construct encompassing identity and expression. This speech will focus solely on the biological aspects. Understanding biological sex is vital in medicine because it influences how we approach diagnosis, treatment, and preventative care for a wide range of conditions. Asterisk 2. Defining biological sex, asterisk. At its most fundamental level, biological sex is typically defined by the chromosomes we inherit. In most humans, this is either XX, typically female, or XY, typically male. These chromosomes dictate the development of primary sex characteristics, including gonads, ovaries, or testes, which produce hormones essential for sexual development and reproduction. Secondary sex characteristics, such as body hair distribution, muscle mass, and breast development, are further influenced by these hormones, particularly during puberty. Asterisk 3. Biological differences and implications, asterisk. It's important to emphasize that biological sex differences extend far beyond reproductive organs. There are significant variations in hormone levels, estrogen and testosterone, while present in both sexes, are typically found at different levels, impacting various physiological processes. Bone density, women are generally more prone to osteoporosis due to hormonal changes, particularly after menopause. Cardiovascular health, men tend to have a higher risk of heart disease at younger ages than women, although that gap narrows with age. Immune system, women often have stronger immune responses but are also more susceptible to autoimmune diseases. Drug metabolism, the way the body processes certain medications can differ between sexes, requiring different dosages in some cases. 4. Intersex variations, it is also imperative to acknowledge the existence of intersex variations. These are conditions where individuals are born with sex characteristics that do not fit typical definitions of male or female. Intersex variations can arise from chromosomal differences, e.g., XXY, X0, hormonal imbalances during development, or variations in the development of internal or external reproductive organs. It is critical to approach intersex individuals with respect and sensitivity, understanding that their experiences are diverse and that medical interventions should be guided by their individual needs and informed consent. 5. The importance in medicine, recognizing biological sex differences is paramount for several medical reasons. Diagnosis, some diseases manifest differently or are more prevalent in one sex than the other. Treatment, dosage adjustments and specific therapies may be necessary based on sex. Prevention, screening recommendations, e.g., mammograms, prostate exams, are often tailored to biological sex. Research, including both sexes in clinical trials is crucial to ensure that treatments are effective and safe for everyone. 6. Conclusion. Summary and considerations. In summary, understanding biological sex from a medical perspective is crucial for accurate diagnosis, effective treatment, and personalized preventative care. It's important to remember that biological sex is a spectrum, and intersex variations exist. Medical professionals must approach all patients with respect, empathy, and a commitment to providing the best possible care, regardless of their sex or gender identity. As our understanding of human biology continues to evolve, we must remain open to new discoveries and adapt our medical practices accordingly. Thank you. Important considerations. Avoid stereotypes. Be extremely careful to avoid perpetuating stereotypes about either sex. State facts based on scientific research, not generalizations. Use inclusive language. Avoid language that excludes intersex individuals or those with variations in sex development. Focus on biology, not gender. Clearly differentiate between sex and gender. If discussing social factors, do so explicitly and with appropriate context. Cite sources. Back up your claims with reliable sources from medical literature. Seek expert review. If possible, have a medical professional review your speech for accuracy and sensitivity. This framework provides a starting point. You'll need to tailor it to your specific audience and purpose, and research the latest scientific findings on biological sex differences and intersex variations. Good luck! To generate more outputs, please sign up for a free account here. Okay, let's craft a speech addressing the topic of biological sex from a medical perspective. Here's a draft, keeping in mind the need for sensitivity and accuracy. Speech. Understanding biological sex from a medical perspective. Good morning, afternoon everyone. Today, I want to address a fundamental concept within medicine, biological sex. It's a topic that is often discussed, but it's important to have a clear and accurate understanding of it, especially within a medical context. From a medical perspective, biological sex is primarily defined by a combination of factors present at birth. These include chromosomes. Typically, individuals assigned female at birth have two X chromosomes, XX, while individuals assigned male at birth have one X and one Y chromosome, XY. However, it's crucial to acknowledge that chromosomal variations exist, such as in Klinefelter syndrome, XXY, or Turner syndrome, XO, which can have significant impacts on development and health. Gonads. These are the reproductive organs, ovaries in females and testes in males. These organs produce hormones that play a crucial role in sexual development. Hormones. The primary hormones are estrogens in females and androgens, primarily testosterone, in males. These hormones influence the development of secondary sexual characteristics and play a vital role in various physiological processes throughout life. Internal reproductive organs. This refers to the uterus, fallopian tubes, and vagina in females, and the vas deferens, seminal vesicles, and prostate gland in males. External genitalia. The physical structures present at birth, such as the vulva in females and the penis and scrotum in males. It's vital to understand that biological sex is a complex and multifaceted concept. While these factors are typically aligned, variations can and do occur. Conditions such as differences of sex development, DSDs, formerly known as intersex conditions, highlight the spectrum of possibilities. In these cases, individuals may have variations in their chromosomes, gonads, or anatomy that don't fit neatly into the typical binary categories. From a medical standpoint, understanding biological sex is essential for several reasons. Diagnosis and treatment. Many diseases and conditions manifest differently or are more prevalent in one biological sex than the other. Understanding these differences is crucial for accurate diagnosis and effective treatment. Medication dosage. The way the body processes medication can vary based on biological sex, necessitating different dosages for optimal therapeutic effects. Reproductive health. Understanding the specific reproductive organs and hormonal cycles is crucial for managing reproductive health, including contraception, fertility, and pregnancy. Personalized medicine. As we move toward more personalized medicine, understanding the unique biological characteristics of each individual, including their biological sex, will become even more important for tailoring treatment plans to optimize outcomes. In conclusion, while biological sex is a fundamental concept, it's also important to approach it with sensitivity and an understanding of its complexity. It's essential to recognize that variations exist and that medical professionals need to be equipped to provide appropriate and respectful care to all individuals, regardless of their sex characteristics. Recognizing these differences allows us to provide more effective and equitable healthcare for everyone. Thank you. Key considerations for delivering the speech. Tone. Maintain a respectful and informative tone. Avoid language that could be perceived as insensitive or discriminatory. Accuracy. Ensure that all information presented is medically accurate and up to date. Clarity. Use clear and concise language that is easily understood by the audience. Sensitivity. Acknowledge the complexity of biological sex and the potential for variations. Respect. Treat the topic with the respect it deserves. This speech is designed to provide a foundation for understanding biological sex within a medical context. It is crucial to consult with medical professionals for more detailed and personalized information. Alright, let's talk about assigned sex by a medical perspective. Now, this can be a tricky area because language is evolving, and it's important to be both accurate and respectful. Essentially, when we talk about assigned sex from a medical perspective, we're referring to the classification of an individual at birth, or sometimes prenatally, based primarily on observable biological characteristics. These characteristics typically include chromosomes, hormones, internal reproductive organs, and external genitalia. Doctors use these visible and measurable traits to assign a sex, usually male or female, which is then recorded on the birth certificate. This assignment is crucial for providing appropriate medical care throughout a person's life. It informs everything from expected developmental milestones to potential health risks and recommended screenings. Now, it's vitally important to understand that assigned sex is a biological construct. It's a starting point for understanding a person's biological makeup and potential health needs. However, it's not the same thing as gender identity. Gender identity is a person's deeply felt internal sense of being male, female, both, or neither. It's how someone identifies themselves, and it may or may not align with the sex they were assigned at birth. Modern medicine increasingly recognizes the complexity of sex and gender. While assigned sex is a crucial piece of the medical puzzle, it's just one piece. Responsible and ethical medical care involves understanding the difference between assigned sex and gender identity, respecting a person's self-identified gender, and tailoring medical care to meet their individual needs. This includes being sensitive to the unique health concerns faced by transgender and gender non-conforming individuals. Therefore, when discussing assigned sex from a medical perspective, it's paramount to be accurate, respectful, and cognizant of the broader context of gender identity and individual lived experience. Medical professionals have a responsibility to understand these nuances to provide the best possible care for every patient. Essentially, think of assigned sex as the initial blueprint, but a person's health journey is shaped by a multitude of factors, including their gender identity, experiences, and individual biology. A good doctor considers them all.